Hello everybody, I am Dr. Kalanidhi, plastic surgeon speaking. Today I want to talk to you about abdominoplasty. Abdominoplasty is a cosmetic procedure where postpartum, after delivery of one or two children, ladies tend to have a little bit of excess skin in the below the umbilicus, in the pubic region, in the lower abdomen region, and this fat and sagging skin gives a very unappealing or unattractive appearance. So a lot of women would prefer to get it removed, and the best procedure for doing this is called as abdominoplasty, where we remove the excess amount of skin which is below the umbilicus, and we put stitches which will be horizontally placed so that when they are wearing an undergarment, this will not be visible. The scar can be covered by the panties or the undergarments which are being worn. So what is involved when you are doing an abdominoplasty? Once the patient comes to us, we first identify and say that whether this procedure is going to be useful for them, because some patients may benefit from just liposuction, but we will take a decision after discussing with the patient, and once it is decided, we get some tests done. We get blood tests done, X-ray, ECG, and quite often we also get a CT scan of the abdomen done. This is mainly to find out if there are any small hernias which are, it is missed in the very fatty layer of skin. And also the CT scan will help in finding out if there is any gallbladder stone or some other internal problem which can be explained to the patient, and a decision can be taken about whether surgery needs to be done for that, or we can ignore that and just do the abdominoplasty procedure alone. So once we have decided to go ahead and do the abdominoplasty, the patient gets admitted in the hospital the day prior to the surgery, and in the morning when we are starting, the procedure is done with spinal anesthesia or general anesthesia. So spinal anesthesia is a procedure where we give an injection in the back where the whole lower abdomen and the legs get numbed, but the patient will be conscious. But because many patients won't be sleeping through this, we give them general anesthesia where they will not be aware of what is happening to them at all. So once the patient is under anesthesia, we clean the area and we drape it up, and then we make a transverse incision, a horizontal cut, and we will raise the skin upwards, and we will to the extent where the skin has to be removed, and then after removing the excess skin, we stitch it up again in a horizontal position. This horizontal sutures can be either using absorbable suture where the sutures need not be removed, or it is done with the sutures where it may have to be removed after 10 days or 14 days. And the umbilicus also is repositioned and placed at a slightly higher level, which will be the normal level once the procedure is done. And after this procedure, we have something called as a suction tube which is placed to remove excess fluid which may tend to get collected. This tube is retained for about a period of 3 days to 5 days when the patient is in the hospital, and once the drainage is reduced, we remove that and we will discharge the patient. The procedure is fairly safe, and a lot of people have benefited, and they feel very happy after this procedure because the tummy has become better looking now. The cost of the surgery varies from hospital to hospital. In our hospital, it may cost approximately around 75,000, but it can be as much as 2 lakhs or even 2.5 lakhs if you go to a corporate hospital.